employers can now raise religious or moral objections to providing contraceptive care. I'm Bryn McBride of ABC for Health, and we're talking about regulations that were issued that challenge the Affordable Care Act's contraceptive care mandate. Let's remind ourselves what was in the ACA to start, and then we'll talk about what those new regulations are doing. The Affordable Care Act required employer-sponsored insurance plans to cover prescribed contraceptives. This also included an element of counseling, and it was done in a way that added no copay or coinsurance to the patient that was receiving these services. This impacts a lot of women, and we're going to talk about some of the numbers in just a bit. But it also came with some exceptions. If you worked for something like a church and you said that you had a religious objection to this ACA mandate, there was an exception for you to not have to provide, to arrange, or to even pay for that contraceptive coverage. Now, there was much litigation in this area, as many of you probably remember, and that created a second category that was more an accommodation than an exception or an exemption, and this was for those nonprofits or other agencies that were not churches or religious organizations, but that they certified they had a religious objection. So that's where the Affordable Care Act left us, with a contraceptive care mandate with an exception for religious organizations and accommodations for those made that certified they had religious objections. Then let's fast forward to October 6th. New regulations were issued on October 6th that fall into two categories: religious exemptions and moral exemptions. Now, the religious exemption it provides no pathway for having a verification that you actually do have a religious belief, and it is not unique to just churches. You could be one of those nonprofit organizations, such as a nonprofit hospital or a religious organization that is not a church, and you want to say you have a religious exemption, and you can be either nonprofit, you can be publicly traded, you can have any structure, and you can fall into that religious exemption. And again, you don't have to certify that that belief actually exists. The moral exemption regulation does not apply to publicly traded entities, but it does apply to the other categories of businesses. And you don't necessarily need to certify your moral objection, but you do have to follow whatever your state law prescribes. So we have two categories: religious and moral. Religious is a very loose definition of religious exemption. Moral exemption applies to a limited number of agencies, but again, much broader than the Affordable Care Act's exemptions or accommodations, and you do have to follow your state law if it does have a law in the books about moral objections. Now, these are all in response to a Trump executive order. It went to, again, the Treasury, Labor, and Health and Human Services agencies, three agencies that have been charged with drafting a lot of the regulations that come out of executive orders on the topics of health care and coverage. Now, these regulations took effect immediately. They were interim final regulations, and they take effect immediately. However, the public comment period is still open. You can still comment on these regulations through December 5th. Now, these new rules roll back federal requirements that employers must include birth control in their plans. Exemptions to any employer that objects on religious or moral beliefs, this is what it applies to. So this is a broad application. Now, I said I was going to comment on how many women were impacted by the Affordable Care Act mandate. The number won't surprise you. It's about 55 million women that were covered because the Affordable Care Act mandated birth control and contraceptive coverage and counseling. The new rule is suspected to impact hundreds of thousands of women, although a lot of the papers surrounding the executive order and the regulations say that the impact is generally not known because it is still not clear how many employers are going to raise their hand and say, we have an objection. Lawsuits, threats of lawsuits from advocacy organizations, women's health organizations, and several states' attorneys general have already been filed. You've got states like Massachusetts, California, and Washington already filing objections to this contraceptive care federal regulations that are coming out. Wisconsin's Paul Ryan has given his own comment on it, and it's the opposite of these states' attorney generals. He sees the day that this executive order was signed and the day the regulations were issued as a landmark day for religious liberty. You can read a lot of this information yourself, including what the ACA mandate actually looks like on healthcare.gov. There are a lot of news sources covering this, so we share a couple of those links with you as well. You can keep your finger on the pulse and stay connected to us. You can share your healthcare story, send us an email, or ask us a question all through our website at healthwatchwisconsin.org. Thanks for joining us.